joining me in studio today. Once again, I have the pleasure of welcoming Natalie Bubela, who is the Executive Director of MAHC. Thank you, Natalie, for coming in. Appreciate it. I wish it was under better circumstances. Unfortunately, we're back to a bit of a strained situation with the hospitals and the towns again, this time under the testing of COVID-19. Mm-hmm. So first of all, I just wanted to kind of go over the little bit of history with you on this. So the family health teams have passed off the testing to MAHC, and MAHC is, I guess the best way to put it is MAHC has taken on this role to provide this service to the community still. Is that correct?
Yes, basically that is correct. I guess I could just make sure that the facts are out there. Mm-hmm. So both of the family health teams have actually operated each of the assessment centers since back in April. And so the decision to close the two centers were not MAHC's, because MAHC did not operate them. They were both of the family health teams decided to cease operations last Friday. Given the gap that there would have been in assessing here in Muskoka and area, the hospital has stepped up to pick it up.
Okay, so what you're telling me is there was no obligation on your part to take over this. You have stepped in to help the community out.
Yes, I would say that that's correct. Having said that, there are hospitals in other areas throughout Ontario that are actually operating these centers. Mm-hmm. But right from the beginning, the hospital was not part of that. So yes, we have stepped up to fill the gap.
Okay, so let's talk about the testing center as it is now, and I guess the reasons why there can't be one set up in Huntsville. So you have the one in Bracebridge, and as I understand it, the story we did with you guys was that there was an opportunity to have the facility in Bracebridge because of that building near the hospital that's not really in use right now for anything else, right? So just explain to me, I guess, why there's not an opportunity to have a similar space in Huntsville.
Sure. So I think there's two reasons for why the center was selected to be operated out of Bracebridge. One was the availability of space. So in this pandemic, there has been huge requirements around physical distancing and the infection prevention and control requirements. And as a result, hospital operations have had to transition into other spaces. We've actually given notice to some external service providers that were operating out of the hospital and have asked them to find other space so that we could transition into that space. So we don't have space available. The only place that we could on hospital property operate this assessment center was actually in Bracebridge in a portable that's at the back of the building that we've retrofitted. So space was obviously one of the things that was required, or variables. Mm-hmm. The second was to have the resources to actually be able to staff the center. So again, going back to the pandemic has created some huge challenges around hospital operations. We're experiencing much higher volumes than we've had in the past, including acuity of the types of patients coming in through our emergency department. We have ALC, which is alternate level of care challenges in the organization because we're not able to move people to more appropriate environments. Okay. We have high isolation burden. We have physical distancing requirements, and as I indicated, by transitioning to other space, that requires additional staff to be able to look after patients in those areas. So when you put all these challenges together, we're very strapped or strained around our ability to provide staff to do anything else besides our core mandate, which is acute care services. Of course. So when we looked at the possibility of stepping up and operating in a center in the absence of the two family health teams, we determined very quickly that we were only able to provide one center because that's all the staff that we had available to be able to pull from acute care services.
So you've sort of answered my next question, but I'm going to ask it anyways just for the sake of making sure that we cover the bases here. Now, one fact that was brought to my attention was that the Active Living Center was an option that was brought forward to MAHC as a testing site. Mm-hmm. What was the reason that you couldn't use that site for that?
So again, what we wanted to do was have some flexibility in our staffing. Mm-hmm. So it was very important for us to be able to have the assessment center actually on hospital property. Mm-hmm. That way, if there are surges in activity or someone calls in sick, you can more easily pull staff that might or might not be available to be able to move into the center. Once you're off property, it's very difficult. Okay. The other aspect is that the cost, and even though this decision was not around cost, I think it's important for me to be a good steward of the public purse. The cost of cleaning the previous 2 assessment centers on a daily basis was exceptionally high through an external provider.
Okay.
This way, by providing it on hospital property, we can use our own environmental services staff. And to be quite frank, I mean, I have absolute confidence in their ability, given their training and the experience they've had up to now in the pandemic, to ensure that that environment is safe, not only for our staff, but those patients coming in to be tested.
Okay. And again, just to cover the bases, that other testing center in Site B was not available, I guess, for usage for the hospital then?
Correct. So what the hospital did historically with the family health team here in Huntsville was actually offer a space on hospital property, which was the NASM building.
Okay.
And as we all know, at the beginning of the pandemic, many services and educational facilities closed down. So we knew that we had an opportunity to use that space until the end of August. And now our NASM students are back. We have about, I think it's 9 medical students that are 4th-year students that are back, and that's their space. And it's the contract and understanding that we have with the Northern Ontario School of Medicine. So they've deferred for a couple of weeks, and we're finding them space elsewhere. But as of September, they're back in that NASM building.
Okay. So I want to move now to this letter, which was, I have a copy of here, and it was sent from the mayor to yourself and Mr. Renwick. Unfortunately, this letter was not provided to all media, just to one organization, but I do have a copy of it anyways through that organization. And there's quite a bit of wording here in terms of how this is unacceptable, that MAHC is sort of pitting Bracebridge and Huntsville against each other in a situation familiar to another discussion that happened with the 2 hospital sites, and as well as residents in East Perry Sound and Huntsville having a more difficult time to get tested. So I just want to, the main reason I guess I pulled you in here today, Natalie, is to give you an opportunity to respond to this specific letter.
Sure. So we've actually penned a response to the mayor that will be going out later on today to respond to some of the comments that came out in her letter, and that's for between the mayor and ourselves. But I will say that our decision to operate, as I've already indicated, the center in Bracebridge was not political. It was not an opportunity to pit communities against each other. And in fact, we have an obligation to provide services to all of Muskoka area. And in fact, there are 5 municipalities plus the municipality that's in Georgian Bay that we traditionally respond to and meet the needs of those people's health care. And as a result of that, the space, the staffing, the need to be able to address all of our community was the reasons for placing that assessment center in Bracebridge. So there was no politics involved in this. It's unfortunate that that is what this has turned out to be. I would also say that I believe that there is misinformation in the letter that the mayor did send, which is indeed unfortunate. The hospital has regular meetings with our political leaders, and on August 11th, the information around the approach the hospital would be taking as a result of the family health teams stepping back was shared with all the political leaders, and Mayor Teresiana was on that call. We also provided written minutes of the meeting to all the mayors. I've had personal conversations with the mayor. I've also had a conversation through the district chair, who convened a Zoom call with both the mayor of Huntsville and Bracebridge, the family health teams, myself, our board chair, and of course the district chair. And again, all the facts around the situation were again shared, and shared openly and transparently. So it is disappointing that the letter was not an accurate reflection of the discussions that we've had.
Do you, just on a personal level, do you think this could have been dealt with in a different way than how it has been now, sort of escalated to this, again, argument, that's happening?
I think so. From my own personal opinion was, wow, look at this. The hospital's stepping up to fill a gap that's been created. And I'm not in any way wanting to badmouth the family health teams. They had their reasons for why they couldn't continue. But the real fact here is there would not have been any testing in Muskoka if the hospital hadn't stepped up. And I think that's the story that should have gone out. I would also say that I know there are concerns out there around the distance some people have to travel. I mean, we understand that. But again, we need to balance the service that we're providing for all of our catchment area And my understanding is the 45 to 30-minute drive that may be experienced by people is not any different from the drive that's experienced in other rural areas throughout Ontario. But I'm not saying that to any way belittle the concerns that some people can have around this. So please reach out to us. There may be some other things that we can do for those people that can't make it into the center. We do know that our Muskoka Paramedic Services is going to be continuing to have pop-up drive-thrus, and in fact can actually reach out to people in their homes in selected situations. So please reach out to us.
Okay. Well, Natalie, I appreciate you taking the time and opening up about this situation. I know it's been tense, and you know, I think in the end of the day, we all just want to make sure that everyone gets through this okay. Yeah. So I appreciate that, and
Thank you for having me.
No problem, and we look forward to more positive news coming out in the future. So thanks again.
Thanks.